A 35-year-old woman consumed laundry detergent daily. This is how her kidneys nearly failed. LS is a 35-year-old woman presenting to the emergency room with extreme swelling and what the medical world refers to as anasarca, a severe and generalized edema. She tells the admitting nurse that for the past 2-3 months, she had been ingesting liquid and powder laundry detergent up to 4 times daily. The reason behind her unusual consumption was not an attempt at self-harm but stemmed from a psychological compulsion related to the aroma of the detergents. LS explained that she found the scent comforting and reminiscent of a happier time in her childhood when her mother would do laundry. This nostalgic connection turned into a dangerous obsession. Living alone and feeling increasingly isolated during a period of intense stress and depression, LS's initial harmless sniffing of laundry detergent bottles escalated into tasting and eventually consuming the substances. The detergents contained sodium dodecylbenzenesulfonate and sodium silicate, chemicals known for their cleaning efficacy but also for their potential toxicity when ingested, capable of causing severe renal damage. As strange as it sounds, this habit spiraled out of control, leading her down a path that most of us can't even begin to imagine. Faced with her reflection, a body severely swollen beyond recognition, LS was gripped by fear. This alarming sight was the catalyst for her urgent decision to seek medical help. Overwhelmed by the consequences of her actions, ingesting laundry detergent, she rushed to the hospital, driven by a desperate hope for recovery. There, amidst her anxiety and vulnerability, her health deteriorated rapidly. The doctors were baffled, but the diagnosis soon became clear: acute renal failure. But this is no tall tale. This is not a hypothetical scenario, but a real-life story of a woman's battle with acute renal failure. Upon her admission to the hospital, her vital parameters unequivocally signaled an impending medical emergency. The consulting medical team, cognizant of the severity, promptly requisitioned an extensive array of diagnostic assays. The outcomes were as astonishing as her idiosyncratic behavior. Her serum creatinine concentrations, a critical marker for renal function, were measured at an unprecedented 24 milligrams per deciliter, significantly exceeding the customary reference interval of 0.6 to 1.2 for females of her demographic. But that wasn't all. Her glomerular filtration rate, or GFR, a yardstick by which the kidney's cleansing efficiency is gauged, was skirting dangerously close to an unthinkable 2 milliliters per minute. The readings painted a dire picture of rampant renal dysfunction. Armed with this troubling knowledge, the medical team had no choice but to label her condition acute renal failure, a terrifying scenario where the kidneys cease to function. But were they intimidated? Far from it. Dialysis was urgently initiated, a life-saving process replicating the function of healthy kidneys, their first line of defense against the onslaught of waste, salt, and excess water threatening to overrun her body. Simultaneously, they deployed supportive care measures, striving to neutralize the corrosive impact of the consumed detergents. Medications were administered, her vitals meticulously tracked, every sign of positive bodily response a ray of hope in the grim scenario. Her case was anything but routine, but the medical warriors were prepared. Their swift retaliation, featuring the immediate initiation of dialysis, was critical in stemming the tide of her acute renal failure, nudging her towards the long road to recovery. The first victory was won when the dialysis began to work its magic. This extraordinary tale serves as a stark of the decisive role of rapid diagnosis and intervention in the battle for survival, even when pitted against the most formidable and unusual medical adversaries. Post-dialysis, the improvement was nothing short of remarkable. After the intervention, there was a noticeable change in the woman's condition. Her alertness and orientation to her surroundings gradually returned, signaling a significant turnaround in her recovery journey. The seemingly impossible was becoming possible thanks to the wonders of medical science and the resilience of the human body. But let's take a step back to understand the underlying factors that led to this situation. The culprits behind her condition were chemicals found in everyday laundry detergents, sodium dodecylbenzenesulfonate and sodium silicate. These compounds are known for their renal toxicity. The chronic consumption of these substances poses a significant threat to renal function. This case serves as a stark reminder of the potential dangers lurking in everyday products, a fact that is often overlooked until it's too late. In this case, the woman's unusual habit had spiraled out of control before she sought medical help. But once she did, the medical team sprang into action, diagnosing her condition and swiftly implementing a treatment plan. Healthcare professionals are often faced with unique and challenging cases, and this one was no exception. Let's take this as a lesson learned and a reminder to always be mindful of what we put into our bodies. Thank you so much for watching Medical Toxicology. Take care of yourself.